The emergency klaxon rang out across Medical Bay 6 of the Joint Interspecies Research Station, orbiting Yavax 3. Inside the sterile chamber, 3 alien students huddled around the operating table, their translucent skin faintly glowing under the surgical lights. The subject, a young Draylen named Reek, lay unconscious, chest rising in shallow, uneven breaths. His thoracic sac had ruptured during a zero-gravity training drill, spilling biofluid into his lower respiratory cavity. "We have less than 20 minutes, hissed Dr. Sirix, the lead instructor. His 6 fingers moved rapidly across the control panel, pulling up Reek's internal scans. "The pressure is climbing. If the lower lobe collapses, we lose him." Siv, the tallest of the 3 students, adjusted her translator implant. "The suture drone isn't calibrated for Draylen tissue. The velocity of recoil is beyond what the filament can manage." "Then we switch to manual," said Dr. Sirix. "Prep the incision, activate the containment field." A red light blinked over the sealed chamber door. The Draylen's anatomy required careful intrusion. One wrong move, and the flexible sacs near the spine would rupture. Siv's hands trembled. Then the door hissed open. "Hold on," came a firm voice. Brady Ellis, a human assigned to the engineering team, stepped inside without the usual panic that preceded a code red call. His face was pale, and he carried a small canvas pouch in one hand. 2 guards moved to stop him, but Dr. Sirix gestured them back. "You're not cleared for surgery," Sirix snapped. "I know," Brady said, "but I heard the call, and I've worked on Draylen filtration systems for 6 months. I know their intake pressure ratios." Siv looked at him, blinking. "We're not fixing a filter, he's dying." Brady glanced at the display. "I know, that's why I'm here." "You are not trained," Sirix repeated sternly. "I'm not trying to take over," Brady said, opening the pouch. Inside was a basic human field suturing kit. "But you're using a calibrator meant for carbon weave musculature. Draylen's use layered collagen spirals. The recoil isn't the problem, the adhesion is. You need a hand-threaded suture." Siv's eyes narrowed. "With what? That?" She pointed at the curved needle in Brady's hand. "That's primitive, it isn't even bonded." "But it works," Brady said. "I've used it on myself before. I can match the spiral tension ratio. I'm not saying I can save him, I'm saying I can try, and maybe buy you enough time to stabilize the rest." Dr. Sirix stared at him for a long moment, then turned to Reek. The monitor beeped, pressure spiking again. "Give him 2 minutes, Sirix muttered. Brady moved fast. He didn't waste time explaining. He washed his hands, snapped on gloves, and hovered over the incision. Siv and the others watched as he bent close, threading the needle with a fine synthetic fiber, then eased it into the ruptured sac wall. Reek's chest shifted with each breath. Brady's hand barely moved, each stitch following the curve of the spiral tissue. He paused once, his brow slick with sweat. The Draylen's internal temperature was hot, almost too hot for human skin. "Rupture stabilized," Siv murmured, watching the monitor. "What is he doing?" "Manual tension match," muttered Dr. Sirix. "He's not just closing it, he's following the internal pattern." Brady didn't respond. His shoulders were hunched, fingers locked in rhythm. "2 more," he whispered. The field was silent except for the soft beep of the monitor. Siv watched the numbers begin to steady. The bleeding slowed. The sac began to refill. "Last one," Brady whispered again. He tied the final knot and stepped back, breathing hard. "Seal the incision," Sirix barked. Siv and the others scrambled to apply the stim gel and activate the dermal closure field. Brady leaned against the wall, pulling off his gloves. His hands were shaking. Dr. Sirix stepped forward. "That was not protocol. You risked cross-contamination." "I sterilized it," Brady replied, voice low. "And I wasn't going to let him die if I could help." Sirix looked at the monitor. "His pressure is stabilizing. We'll keep him under observation for 72 hours. If there's no rejection, he may pull through." Brady nodded. "Good." Then his knees buckled. Siv caught him halfway down. "You're burning up." Brady winced. "I didn't notice." Sirix scanned him with a portable reader. You've been in that Draylen chamber for 6 months. You're showing signs of internal heat stress. Your dermal layers are dehydrating. Brady slumped further. Can we not talk about that right now? You need fluids and cooling, Syrinx said. You're not leaving on your own. Civ and the others looked stunned. He stitched the rupture by hand, one muttered. No scope, no stabilizer. Syrinx turned to the others. Lesson 1, never underestimate what the unexpected can bring. Lesson 2, get him to recovery. Now, Brady didn't argue. He was too tired to stand. As the medics arrived, Civ looked down at the small needle still on the tray. That tiny thing saved a life, she said quietly. Syrinx nodded. It did today. 3 hours later, the recovery wing's overhead lights dimmed slightly in accordance with the station's circadian cycle. Most personnel had rotated out, save for the night shift medics and a few students lingering near the observation deck. The room was kept at a cooler temperature now, adjusted specifically for human physiology. Brady lay propped against an inclined med bed, one arm hooked to a fluid line, the other resting on a thin blanket laid too neatly over his legs. His eyes were open but unfocused, following the soft pulse of diagnostic lights blinking on the wall. A faint hiss of cooling mist drifted from a unit overhead. The door slid open with a quiet chime and Civ stepped in, her gait slower than earlier. She carried a translucent container in her lower arms, filled with what looked like a tangle of dried kelp and shimmering resin nodules. She didn't speak at first, only moved to the chair across from him and sat without ceremony. Brady glanced at the container. I hope that's not hospital food. It's a Draylen ceremonial nutrient, Civ said. It's offered when someone intervenes in a life-threatening moment. It's not intended to be eaten. You're supposed to keep it until the scent fades. Brady blinked once. You brought me a souvenir of stress. It's a symbol of respect, Civ said flatly, and a warning not to repeat the event that caused it. Brady gave a slow nod. Fair enough. Civ leaned forward slightly, her head tilting to observe his arm. The fluid delivery rate is low. You're metabolizing faster than expected. Human livers are stubborn, Brady said, voice dry. Probably doesn't help that I've been working in Draylen environments for half a cycle. You should have reported the dehydration symptoms, Civ replied. Ignoring system stress is reckless. I didn't ignore it, he countered. I just didn't expect to be in surgery today. That's not the part I'm questioning, she said. What I don't understand is how you knew the spiral tension pattern. It's not in the standard engineering documentation. Brady exhaled slowly. I ran into a Draylen pressure chamber failure 2 months ago. The spiral layers had collapsed inward like a ruptured coil. I had to reconstruct the filter manually to trace the leak. After that, I started tracking how they layered, thought it might help with maintenance. Civ narrowed her eyes. You memorized internal biological patterns from fixing an air filter? I didn't know they were biological at the time, Brady said. I just thought the structural design was interesting. Civ sat back. You're not a surgeon, no, Brady agreed, and I don't want to be mistaken for one. I wasn't trying to do anything but stop the bleeding. There was a pause. Did you feel it? Civ asked. Brady frowned. Feel what? The Draylen sac, when you threaded it. Did you feel the compression tension shifting under your hand? I felt something, Brady said after a moment. It was like stitching through a live spring. Every motion had to counter the last. If I pulled too fast, it would have recoiled. Civ looked at the container again. That's why it worked. The drone can't adjust dynamically, it recalibrates after each movement. You match the pattern in real time. Brady didn't say anything. You weren't trying to prove anything, Civ said. But you did something none of us were trained to do. I didn't do it alone, Brady said. You prepped the field. Syrinx gave the order, I just stitched. Civ didn't argue, but her expression didn't soften. You realize how rare that is. To respond to a rupture without diagnostic overlays or field mapping, Brady looked away. I don't know about rare, I know it was terrifying. Civ stood and began pacing slowly. We're taught that biological systems are too complex to trust to instinct. Every action is supposed to be calculated. But you acted on feel. Not instinct, Brady said. Experience, trial and error, and probably a little desperation. Civ stopped near the window. The stars beyond the station canopy shimmered like static. Reek's going to live, she said. I'm glad, Brady said softly. I think he'll want to speak with you when he wakes. I'll wait until he's ready. Civ turned to face him again. You're not what I expected from your file. Brady raised an eyebrow. You read my file? I was curious, Civ admitted. It said you had field mechanic certification and 2 prior citations for unauthorized tool improvisation. Brady made a face. That was 1 time. Okay, 2 times, but the second one wasn't even dangerous. You bypassed a coolant fail-safe with a meal tray, Civ said. The coolant line was frozen. The tray was heat-resistant. Civ gave a long exhale. I don't understand how your species tolerates that kind of risk. We don't always tolerate it, Brady said. Sometimes we just don't have better options. Civ crossed the room again and set the container of Dralin nutrient on the table beside him. Reek's family will want to know who intervened. I'll record your report. I didn't do it for a record, Brady said. I know, Civ replied. But it matters anyway. The silence stretched for a moment. The cooling mist hissed again above his head. Then the door opened once more and Dr. Syrinx entered, his gait stiff with exhaustion. He didn't look at Civ, only at Brady. You're stable, he said bluntly. But you'll remain on bed rest until your core temperature drops. No exceptions. Brady nodded. Syrinx glanced at the Dralin nutrient. They don't give those lightly. I gathered, Brady murmured. Syrinx hesitated at the door. You shouldn't have been in that room. I know. But you were, Syrinx said, and your interference was not conventional. Brady looked up. Is that a problem? Syrinx's eyes narrowed slightly. It's an anomaly. One I'll be reporting to the Interspecies Medical Board, not as misconduct. As observation. Civ stepped aside to let him pass. Syrinx paused just before leaving. If you ever attempt something like that again, you'll undergo formal biological training, whether you want it or not. Brady smiled faintly. Noted. The door closed behind him and Civ sat again. Your species, she said, has a strange relationship with protocol. Brady let his head fall back against the pillow. Yeah, we tend to notice that. She studied him for another long moment. I'm still not sure what to make of you. I'm not sure either, Brady replied. But I think I'm going to sleep now, if that's all right. Civ stood and picked up the nutrient container. I'll leave this near the vent. The scent will last longer. Lucky me. As she left, the mist above his bed adjusted again and the lights dimmed to a cooler hue. Brady closed his eyes. He wasn't thinking about recognition or consequences. He was thinking of the way the Dralin tissue had shifted under his fingers, not like a machine, but like something alive that was trying to hold together. And for some reason, that stayed with him long after sleep took over. 7 hours after the Dralin's vitals had steadied, the hallway outside the recovery wing filled with a quiet, uneasy tension. Civ stood by the wall console, arms folded, her attention fixed on the biometric feed scrolling in front of her. The data was no longer critical, but she kept watching anyway. 2 of her classmates, Nyril and Thax, had joined her. They weren't speaking much either. The door to the medbay slid open behind them. Brady stepped through slowly, wrapped in the same thermal robe issued for heat-stressed patients. His gait had improved, but his shoulders were hunched slightly forward as though unsure whether he was supposed to be upright at all. You're not cleared to leave the wing, Civ stated without turning. I didn't leave, Brady replied. I just relocated. The bed was making a noise I didn't trust. Nyril turned to him, her compound eyes narrowing. You should be in passive recovery. That's what the medical board logged. I'm not planning to run laps, Brady said. I just needed to move. Thax stepped closer, his voice lower, more deliberate. Reek regained partial consciousness. He hasn't spoken yet, but he's aware. He opened his secondary eyes. Brady nodded once. That's good. You should come, Civ said. He can't speak, but he's tracking motion. I think he recognizes us. Brady hesitated. Are you sure that's appropriate? Thax gestured toward the far door. He wouldn't be alive if not for what you did. Even if he can't say anything, your presence might help. They didn't wait for him to object. Civ turned and walked down the corridor, and the others followed. Brady trailed behind with slower steps, eyes fixed on the floor pattern as if it might shift beneath him. Inside the Draylen intensive suite, the atmosphere was humid and tinted with a faint violet hue. Reek lay immersed in a semi-liquid suspension, his body supported by a thin, exoskeletal cradle. Small pulses of light moved across his chest where the wound had been closed. His breathing was steady now, but slow regenerative cycles in progress. Civ approached and tapped the side console gently. "Reek," she said, keeping her voice level. "You have a visitor." Brady stopped just inside the threshold, unsure how close to approach. Reek's upper eyelids twitched, then lifted slightly. His gaze shifted toward the sound of Civ's voice, then slowly over to Brady. The Draylen's pupils dilated. "He sees you," Civ confirmed. Brady stepped a little closer, uncomfortable under the attention. "Hey," he said quietly. "Sorry I didn't ask before I stitched you up. It was kind of a rush." Reek blinked once, then twice, his gill folds fluttering. "I'm not exactly sure what the protocol is here," Brady went on. "I just wanted you to know well, it wasn't about trying to prove anything. I didn't want you to die, that's all." Reek's breathing hitched slightly, then resumed its rhythm. Civ watched the monitor. "That's a stabilization spike," she said. "A positive one." Thax tilted his head. "You may have triggered an autonomic recognition response." Brady rubbed the back of his neck. "I'll take that as a polite hello." They stood in silence for a few seconds before Nyril asked, "Why did you carry a manual suture kit at all?" Brady looked at her, surprised by the bluntness. "I didn't, I made one. It was part of a small repair kit I keep in my locker, old habit from training rotations. You never know when you'll need one." "You weren't supposed to be in Medical Bay 6, Nyril said. "Your assignment was habitat engineering." "Yeah," Brady said. "I heard the code call over the general comm. Recognized the location. I didn't expect to be let in, I just showed up." Civ crossed her arms. "You didn't hesitate." "I did," Brady said. "You just didn't see it. I hesitated right up until I saw the scan of the rupture." "Then it was muscle memory," Thax frowned. "But your muscle memory wasn't trained for Draylen physiology." "No," Brady agreed. "It was trained for fixing things that don't wait for the right tool or the right clearance." Nyril's gaze lingered on him. "That's a deeply chaotic method. It's also how I learned to survive in deployment," Brady said. "Sometimes the only tool you have is the one you know how to use." Reek's gill folds pulsed again. Civ glanced at the readout. "He's responding to tone." "You're triggering a neural spike with vocal cadence." Brady gave a small, uncertain smile. "Guess I'll try not to sound too dramatic." "Don't," Civ said. "It destabilizes the metrics." Brady stepped back slightly. "All right, I didn't come to give a speech. I just wanted to see if he was okay." "He's alive," Thax said. "You did something that wasn't supposed to be possible." "It shouldn't have been necessary," Brady replied. "I'm not proud of the situation, just relieved it didn't end worse." Nyril tilted her head. "Would you have done the same if it were a species you'd never worked with before?" Brady didn't answer right away. "If I thought I could help." "Yeah, doesn't matter what they are." Civ watched him for a moment. "You understand that your actions are being reviewed by 3 separate boards." "I assumed as much." "Some are calling it improvisation," Nyril said. "Others are calling it reckless pattern mimicry under stress." Brady nodded. "I wouldn't argue either," Thax added, and one report referred to it as untrained instinctual calibration through non-augmented tactile interface. Brady blinked. "That's a long way to say stitched it by feel." Civ finally let out a breath. "I don't know what to call it." "But I saw it work." They stood in silence again. Reek's eyelids fluttered closed, the monitors steady and calm. "I should go," Brady said, turning toward the door. "You've got it from here." Civ stepped forward. "Wait," he paused. "During the procedure," she said, "you said something." "Just before the last suture." Brady looked over his shoulder. "Yeah," you whispered, 2 more and then again, last one. Why did you count out loud?" Brady thought about it. That's a habit I picked up when working under vibration stress. Helps me keep rhythm when my hands want to shake. Saying it out loud anchors the motion. Niall's expression shifted slightly. So it wasn't for anyone else, it was for you. Brady nodded. I wasn't trying to be poetic, I was trying not to mess up. Siv stared at him for a long moment. That might be the most human thing I've ever heard, he shrugged. Maybe, or maybe it's just the most honest. No one stopped him as he left, though all three students remained watching, as if trying to trace the logic backward from outcome to decision. But there was no algorithm for it, no training module that matched what they had seen. Only a needle, a thread, and the strange, unsettling realization that sometimes the solution didn't come from the textbook. It walked in uninvited, whispered numbers to itself, and left quietly without asking for recognition. 36 hours later, Brady stood in the diagnostics chamber with a pale blue thermal wrap clutched loosely around his shoulders. The room was quiet, save for the soft hum of scanners cycling through their routines. A thin band of yellow light swept across his torso, then disappeared. He stayed still, eyes fixed on the small, flickering display in front of him, though he wasn't really reading it. "You're not supposed to be back on your feet yet," said Dr. Sirix as he entered, holding a thin data rod between two fingers. "Your internal temperature only just rebalanced. I'm not running laps," Brady said. "You asked me to report." Sirix inserted the rod into the wall port and the display shifted. "I asked for a debrief when you were medically cleared." "You're not cleared. I'm lucid, I'm vertical, and I didn't touch anything. That's 3 more permissions than I usually wait for." Sirix didn't look up. "That's not reassuring." Brady shrugged one shoulder. "Didn't mean it to be." Sirix folded his lower arms across his chest and finally turned to face him. "We reviewed your actions again. The board has more questions." Brady sighed. "I'm not sure what else I can tell you. They are not about the procedure. They're about the decision." Sirix tilted his head. "You've been stationed here for less than a full cycle. You're not embedded in Draylen cultural protocols. You had no personal connection to the patient. What made you initiate a response normally reserved for senior trauma specialists?" Brady chewed his lip for a moment. "No one else was moving." "That's not an answer. It's the truth." Sirix stepped closer. "You weren't the only one in the room. Siv, Niall, and Thax were trained in Draylen anatomy. I was present, yet you inserted yourself with no clearance." "I didn't think I was the solution," Brady said, "but I saw a problem I recognized. I thought I might buy you time." Sirix narrowed his eyes. "You realize that if your threading had failed, Reek's lower cavity would have collapsed completely." "I know. And you assumed that risk without being asked." "I didn't have time to consider the alternative." Sirix didn't respond immediately, then he turned back to the console. "You're either very reckless or very calculated." "I don't think those are mutually exclusive," Brady replied. Sirix tapped the console twice. "The Draylen High Matriarch has requested a report on the incident. It will be translated and archived." Brady raised an eyebrow. "Why would they care about a field stitch?" "It wasn't about the technique," Sirix said. "It was about what it implied, that a non-affiliated technician responded with effective action outside protocol." Brady folded his arms. "That a human did something unexpected." Sirix turned back again. "That someone did something unstructured and it worked. That's what they're examining." Brady said nothing. Sirix paced slowly. "I reviewed the recording a dozen times. You didn't hesitate once your hands were in motion. You shifted speeds with each suture and adjusted depth mid-thread." Brady looked at the floor. "I wasn't thinking about technique. I was thinking about how not to tear the tissue." "You didn't just avoid tearing it," Sirix said. "You matched the tension gradient across a living structure in real time. That's not improvisation, that's something else." "I didn't know what else to do," Brady said. "That's all it was." Sirix studied him. "You know, most species would not have attempted that. Even with theoretical knowledge." "I'm not most species," Brady said, voice quiet. "I'm just me." There was a pause. Then Sirix gestured toward the far door. Come, Reek has regained lucidity. He asked for you by gesture. Brady blinked. Gesture? He tapped the lower right quadrant of his cradle pad. It's Adraelin's signal for summon the one who intervened. Brady followed without protest. They entered the Adraelin recovery chamber again. The lighting had adjusted slightly, now a warmer hue to accommodate the regenerative cycle Reek had entered. The Adraelin's eyes were open, steady, his posture more supported within the fluid cradle. Civ stood to the side, monitoring a set of graphs. She looked up when they entered. He's been more alert the last hour, she said. He's not speaking yet, but his gill patterns are consistent with recognition. Brady approached slowly. Reek blinked, then moved a single digit toward the side of the cradle again. A soft tone sounded and a thin panel illuminated with a pulse. He knows you're here, Civ confirmed. He's recording. Brady looked at Reek and gave a small nod. I don't know if you understand Common, but I'm glad you're recovering. Reek's pupils dilated and one of his gill slits flared gently. He's signaling acknowledgement, Civ said. That's voluntary. Brady exhaled. I wasn't supposed to be there, I know that, but I couldn't watch you die when I thought I could help. Reek's limbs shifted slightly within the cradle, curling inward in a way that resembled a Adraelin gratitude posture. Syrinx stepped forward. He's requesting a data marker. Brady looked at Civ. It means he wants to log you into his survival record, she explained. It's a cultural ledger, not ceremonial, it's factual. A record of those who directly altered an outcome, usually reserved for Adraelin healers. Brady hesitated. I'm not a healer. Reek moved again, this time more deliberately, pressing his palm against the cradle's surface until the panel changed color. He insists, Syrinx said, a small, flexible panel extended from the cradle, glowing faintly. Civ gestured to it. Place your hand there. It will register your molecular signature for the log. Brady stepped forward and pressed his palm to the panel. It warmed slightly, then faded. Reek's eyes closed. His breathing remained slow but constant. Syrinx turned to Brady. You've been recorded as a survival agent. That's not a small matter. Brady stepped back. I didn't do it for recognition, Syrinx nodded once, which is why it's being recognized. Civ folded her arms. You know, the more we try to explain it, the more confusing it gets. I still don't understand how you knew where to start. Brady looked at her. I didn't, I just knew where not to. Thax entered quietly from the side corridor. There's a message coming from the Adraelin Cultural Council. They've asked for an image of the tool used. Civ raised an eyebrow. They want to see the needle, Thax nodded. They want to archive it. Brady laughed once, short and disbelieving. It's just a needle. To them, Thax said. It's the reason Reek's alive. Civ looked toward the storage shelf near the med bay entrance. It's still in the tray. Untouched since the procedure, Syrinx nodded. Stored in a sterile containment, we'll have it scanned and transmitted. Brady rubbed his face. This is getting surreal. Syrinx turned to him. You didn't plan for any of this, but it happened, and now there are consequences. Brady nodded slowly. I get that. And you'll be interviewed again, Syrinx added. Not for disciplinary action, for insight, Brady sighed. I'll answer what I can, just don't expect revelations, it wasn't magic. No, Civ said, but it wasn't guesswork either. That's what makes it hard to categorize. Brady looked over at Reek again. The Adraelin remained still, but the gentle curve of his posture no longer suggested strain. It suggested rest. As the others moved to secure the needle, Brady stepped back toward the door. I'm going to sit down, he said. Everything still feels like it might tilt sideways if I stand too long. Syrinx didn't stop him. You'll be debriefed in 3 hours, he said. Rest until then. Brady nodded and left the chamber. Civ watched him go, then turned to Syrinx. What if he hadn't shown up? Syrinx didn't answer right away. He looked at the cradle, at Reek's relaxed frame suspended quietly in the fluid. Then we would have lost someone. And we wouldn't know we could do better. Civ looked down at the tray where the needle sat, now sealed in a containment box. Do you think we'll ever understand how he did it? Thax answered from the side. Maybe not, but we saw it happen. And now we're responsible for what that means. They all stood in silence. the Draylin's steady breathing the only sound in the room. 4 days after the surgery, the station's central forum was rearranged into a configuration rarely used: oval seating, tiered platforms, and a central speakers platform surrounded by an array of polylingual translators. The gathering wasn't ceremonial, but the atmosphere had the dense quiet of something that might become precedent if anyone said the wrong thing. Brady sat on the lower tier, not on the speaker's platform but close enough to feel the weight of observation. He tugged once at the collar of his standard issue shirt, which was stiff from a rushed sonic clean. On his left, a Draylin attendant adjusted the ambient lighting to accommodate the mix of visual sensitivities in the room. Across from him, Siv and Thax were seated, each holding display slates they hadn't looked up from in several minutes. Nyril stood behind them, arms behind her back, unmoving, and Yulari official elongated limbs, crystalline vocal nodes stepped into the central space and raised an arm. "This is not a disciplinary review," the Yulari said. "This is a procedural inquiry and adaptive ethics panel. We are here to determine the extent to which unsanctioned action may inform future protocol in cross-species emergency response scenarios." Brady shifted in his seat and muttered under his breath, "That's a lot of words for what just happened and why." Siv heard him but didn't react. The Yulari continued. "The subject of inquiry is the incident that occurred in Medical Bay 6, Standard Time Marker 87.2, involving the Draylin student Reek, 3 medical trainees and 1 human technician. We begin with factual clarification." A projection lit up behind the speaker, showing a scan of Reek's thoracic cavity mid-rupture. No one commented. Then the scan rewound, needle entering, thread tension shifting, the slow reconstruction of the sac wall. "For those unfamiliar with the sequence," the Yulari said, "this is the moment of manual intervention." A ripple of low sound reaction moved through the observer station staff, medical board representatives, and a few Draylin delegates seated in a vertical cluster near the far wall. The projection froze. "Human Brady Ellis," the Yulari said, "please explain, without revisiting prior statements, what mental framework you used to initiate the threading sequence without reference overlays." Brady cleared his throat. "I didn't frame it in terms of anatomy. I followed the material behavior. Like if you're repairing a pressure sleeve and the internal lining begins to delaminate, you don't fix the tear directly, you match the flex pattern around it. Were you aware of the biological risk to the patient if the pattern was mismatched? Yes. Were you confident the method would succeed? No." Siv looked up at that. The Yulari tapped a node on their wristband and turned to her. "Siv, student of xenomedicine, did you believe the intervention would succeed at the time?" "No," Siv said. "But I didn't think we had any better options available in the window we were given. Did you consider removing the human from the environment? He was already threading by the time I had a chance to process the situation. And you permitted the action to continue." Siv glanced at Brady. "Yes." There was a long pause as the translator nodes shifted to match the responses into Draylin tonal syntax. A Draylin delegate leaned forward, extending a gel membrane toward the mic array. The translator adjusted its frequency to accommodate the subharmonic. "Why did you not use the surgical drone, if we may inquire?" the Draylin asked. Thax answered before anyone else could. "The drone recalibrates after each movement. The rupture required continuous adjustment." The drone would have lagged behind the tissue's recoil rate. The Draylin delegate pulsed a sequence of pale biolight which the translator interpreted as understood. The Yulari turned back to Brady. "You used a human suture needle. Is this standard in your toolkit?" "No," Brady said. "I built it from a dermal patch wire and a reshaped filament from a diagnostic pin." "Why carry such items at all? They've come in handy before." "What is the original intended use of the filament?" Brady blinked. "It was meant to anchor analog monitors. In human systems, they're used to stabilize portable heart sensors." The Yulari paused, then turned to the Draylin cluster. You have requested to archive this tool. A smaller Draylen, younger and with a faint ripple along his thoracic folds, stepped forward. Yes, not as a relic. As a reference, Brady frowned. Why? It demonstrates a pattern of engagement unfamiliar to us. The use of tactile adaptation over procedural certainty. We wish to study the behavior, not the object. The chamber fell quiet again. After several seconds, Syrinx spoke from his place near the back. I've reviewed the footage over 20 times. What the human did was not replicable by our current training standards. It lacked the tiered decision tree we teach, but it succeeded. The question is not whether we can reproduce it. The question is whether we can afford to ignore it. That is not a small question, the Yulari said. No, Syrinx replied. It isn't. The Draylen delegate spoke again, more slowly this time. We do not wish to replace our methods. But we have seen that other species may approach the body not as a sequence of systems, but as a responsive whole. This is not inferior, it is different. Brady looked at Civ. She was watching the Draylen, jaw tense. The Yulari turned back to Brady. Would you be willing to allow a recorded reconstruction of your threading sequence with real-time commentary for training reference? Brady hesitated. I'll try, but I can't promise it'll make sense. I was acting in the moment. We are aware, the Yulari said. That is why we ask. Syrinx stepped forward again. We'll prepare the chamber. He'll need a Draylen tissue analog. I don't need it to be Draylen, Brady said. I just need it to move the same way. Civ raised a hand. We can use the regenerative polymer from the cardiovascular model. It mimics spiral compression and rebound. The Yulari nodded. Accepted. The demonstration will be scheduled within 2 station days. This proceeding is now in adjournment. As the crowd began to file out, Brady stayed seated. Civ waited until the room had mostly emptied before walking over. You didn't have to agree to that, she said. I didn't want someone else trying to guess what I did and getting it wrong, Brady replied. She studied him for a moment. You're nervous. Of course I'm nervous, Brady said. I barely kept my hand steady the first time. Now I've got to explain something I don't fully understand myself. Civ didn't argue. Brady stood, stretching his arms. Do you know what I keep thinking about? What? That I probably wouldn't have done it if I'd had 5 more seconds to think. She tilted her head. You regret it? No, he said. But I know what it looks like when you act before you're ready. One day it works. Another day someone bleeds out. Civ's voice was quiet. You're not wrong. He looked down at his hands. I just hope showing people how I did it doesn't make them think it's a good idea. Civ's reply was even quieter. Maybe it makes them understand when not to do it. They walked out together, not speaking until they reached the corridor junction. As they parted ways, neither one looked back. The chamber behind them dimmed, the needle still sealed in its box, the projection screen dark. But around the station, the data was already being copied, transmitted, and dissected, not because it was perfect, but because it had happened. The reconstruction request had been fulfilled within 23 hours. The demonstration was held in a smaller auxiliary lab, one typically used for training simulations. It wasn't a public event, but the room still held nearly 30 observers' medical leads, Draylen liaisons, and a few neutral recorders from the Interspecies Operations Board. Brady stood behind a transparent barrier, wearing a clean lab uniform and rubbing his palms together as if uncertain what to do with the space between his fingers. On the table in front of him, a synthetic Draylen thoracic analog pulsed with a steady wave pattern, mimicking the shifting tension of a real spiral sac under distress. It shimmered faintly with a film layer that reacted to pressure, turning blue when stretched too far. Syrinx tapped the side panel. You may begin when ready. Your vocalizations will be synced to the central archive. Brady exhaled through his nose. All right. He picked up the tool, still just a curved needle and filament, replicated exactly from the sample he'd built. He rolled it once between his fingers. I'm not going to narrate every motion, he said, his voice quiet but steady. But I'll explain what I'm doing as I go. He touched the analog's outer layer lightly, then pressed in at the rupture site. The polymer reacted, dimming slightly in acknowledgement of contact. "The first thing I noticed," Brady began, "was that the edges weren't symmetrical. That's not a problem in mechanical systems, but in tissue like this, asymmetry tells you how the tension failed. If you close it from the wrong side, you just pull the tear wider." He inserted the needle carefully, threading the filament through with a smooth, practiced motion. "So I started from the collapse point," he continued. "That's where the spiral had lost integrity. I didn't try to pull it tight, I let it tell me how much give it had." The observers watched in silence as he moved to the second stitch, adjusting the angle minutely. "You can't rush this," he said, "and you can't think about how long it's taking. You focus on the response. It's not about sealing it, it's about convincing it to hold itself together." He continued without pausing for questions, threading each line with deliberate care. The analog's surface never turned blue. By the time he tied the final stitch, 12 minutes had passed. Syrinx stepped forward. The pattern held, no overtension, no recoil. Brady set the tool down and wiped his hands on his sleeve. "That's how it happened, more or less." One of the Draylen attendants moved toward the table and examined the closure. "The spiral layers have reformed their natural compression arc. They do that if you don't force them," Brady said. "You just have to give them a reason not to tear again." From the back of the room, a tall figure made his way forward. Reek upright, walking slowly but unaided, his gill folds calm, stepped past the observers and stopped at the edge of the demonstration table. His secondary eyes blinked once. Brady stared. "You're standing." "I'm not running," Reek said, his voice husky but clear, "but I'm here." Brady looked over at Syrinx, who gave the faintest nod. "I wanted to say something," Reek added, "to you while you were still within earshot." Brady lowered his head slightly, unsure whether to speak. "I remember the pressure," Reek said, "and I remember the moment it changed. It wasn't pain, it was alignment, like something had let go and something else had taken over." "I didn't know you were conscious," Brady said. "My body wasn't," Reek replied, "but my sense of balance was." It recognized the correction. Brady folded his arms. "I only did what I could." "You did what we couldn't," Reek said. "That matters more than I thought it would." From the side of the room, Siv stepped forward, holding a small crystalline case. "We have something for you," she said to Brady. He raised an eyebrow. "Another nutrient?" "No," she said. "This one's from all of us." She opened the case and revealed a sealed medallion etched with a spiral pattern, not Draylen, but a stylized version of the suture path Brady had used. It was mounted against a dark background with no inscription. "It's not a medal," Siv explained. "It's a reference point for us, for future students, when they ask what it means to act outside the algorithm." Brady stared at it. "You're calling it, what?" Siv gave a rare, wry expression. "The Ellis loop," he blinked. "That sounds like a navigational error." "Maybe it is," Thax said, stepping closer, "but it's one we now know how to survive." Brady shook his head but didn't argue. Syrinx addressed the room. "This concludes the procedural archive. No disciplinary action will be taken. No formal commendations will be issued. Let this stand as an event of singular context." As the observers began to file out, Reek reached into his side pouch and held out a small folded membrane, thin and iridescent. "This is a Draylen learning film," he said. "It records touch-based memory. I had it with me during the incident. It absorbed the pressure sequence." Brady took it gently. "You're giving it to me. I want it returned," Reek said, "after you've touched it one more time." Brady nodded once and pressed his fingers to the film. It warmed slightly, then cooled. Reek took it back and folded it away. "Now it has both sides of the moment." They stood for a few seconds without speaking. Then Brady stepped back and looked around the now emptying room. "I didn't expect any of this," he said quietly. "You didn't need to," Siv replied. "You just needed to be there when it counted." Brady turned toward the exit. "I think I'm going to grab some sleep, or maybe stare at a wall for a while." "Both valid," Thax said. "No more questions?" Brady asked, looking over his shoulder. "No more," Cyrix confirmed. Brady gave a short nod and walked out, the medallion case still in his hand. The auxiliary lab lights dimmed behind him. Reek, Civ, and the others stood in silence for a moment longer. Then Reek turned to Cyrix. "Do you think it will happen again?" "Something like this," Cyrix considered. "Not the same way, but something like it, inevitably." "And what do we do then?" Reek asked. "We remember this," Cyrix said. "Not as a model, as a reminder." They left the lab without ceremony. Later, the footage would be stored but not widely distributed. The Draylen Archives would record it under anomalous intervention, and the Human Medical Board would label it non-replicable but instructive. Brady would return to his engineering rotation. The needle would remain sealed. And Reek would recover fully, eventually returning to his training with a slightly altered scar and a quiet sense that something outside the expected had granted him another cycle of breath. The station returned to its rhythms. No further incidents occurred. Nothing needed to be said again.